Have you ever really thought about what happens after a doctor in a hospital prescribes you some medicine? You know, that one little pill or IV bag? Well, it turns out it goes on this incredibly complex, high-stakes journey through what's basically a logistical labyrinth. So today, let's pull back the curtain and dive into this hidden world of hospital pharmacology. So here's the big question we're tackling today. How does a hospital make sure that one specific life-saving drug gets from a pharmacy shelf all the way to the correct patient's bedside safely and on time every single time? Believe me, it is a process that is way more intricate than you'd probably guess. Because, at the end of this whole supply chain, it isn't just a delivery point. It's a person, a patient who's waiting for relief, for treatment, for a cure. Getting this final step right isn't just about being efficient. It is absolutely a mission-critical part of taking care of people. To really get how that pill reaches the patient, we first need to kind of zoom out and look at the whole system. This is what we call the drug supply lifeline, and it's pretty much the backbone of everything. So what do we actually mean by drug supply? Well, it's the whole shebang, from start to finish, getting the drugs in the first place, storing them the right way, and then getting them where they need to go. I mean, a hospital can have the best doctors on the planet, but without a rock-solid drug supply system, healthcare just stops. The World Health Organization, they've broken this massive job down into 5 key parts. It all starts with choosing the right medicines, then figuring out how much you'll need, buying them, and storing them. But it's that very last step, distribution, that gets super complex once we get inside the hospital itself. All right, now we're zooming in, we're moving past the global supply chains and right inside the hospital walls. This is where the final and maybe the most critical leg of the journey really begins. See, inside a hospital, drug distribution means something really specific. It's the actual physical act of moving that medicine from a central spot, like the main pharmacy, directly to the patient. It's like the last 100 yards of a 1,000-mile journey. Now, the hospital has to manage 2 totally different paths here. You've got outpatients, the folks who go home the same day. For them, it's usually just a standard prescription you'd take to any pharmacy. But then you have inpatients, the people staying overnight. For them, the hospital is responsible for everything. And that internal process, well, that's where the real logistical puzzle is. So to solve this huge inpatient challenge, hospitals have come up with 4 main systems over the years. Each one has its own philosophy, its own pros, and, of course, its own cons. We're about to break down all 4 of them. Okay, first up is the most traditional method out there. It's a system that probably feels pretty familiar because it works a lot like getting a prescription from your family doctor. It's called the Individual Prescription Order System. It's really straightforward. The doctor writes an order, and then the patient or their family literally takes that piece of paper to the hospital dispensary, pays for the medicine, and brings it back to the nurse. Think of it like ordering a la carte for your meds. Since it's simpler and doesn't need a ton of infrastructure, you see this a lot in smaller or private hospitals. So what are the perks? Well, it's lean. You don't need a huge pharmacy staff. But what's really cool here is the human element. A pharmacist personally reviews every single order. This creates this tight little communication loop between the doctor, the nurse, the pharmacist, and even the patient. Everyone is on the same page. All right, on to our next system. This one tries to solve a big problem with that first method, speed. And it does it by basically bringing the pharmacy a whole lot closer to the patient's room. In a complete floor stock system, the nursing ward itself basically becomes a mini pharmacy. But keeping a full pharmacy on every single ward, well, that can be risky and really hard to manage. And that's exactly why most hospitals choose to go with a hybrid model instead. This combination system is kind of the best of both worlds. For most drugs, they stick with the individual prescription method for safety and control. But they also keep a small, limited stock of common stuff or emergency meds right there on the floor. This gives nurses quick access when every second counts, and you'll see this set up a lot in big government or nonprofit hospitals. Okay, now we get to what many consider the gold standard. This is the most sophisticated and safety-focused system of them all, unit dose dispensing. Its main goal is to slash medication errors, and it works. Some studies show it can cut down major errors by over 80%. The core idea here is actually pretty simple, but it's totally revolutionary. Every single pill, every single dose is packaged and labeled individually for a specific patient, for a specific time. Nothing comes out of a big bottle. Everything is a single, ready-to-go unit. And this picture shows you exactly how it works. This is a unit dose cart. Each one of those little drawers is assigned to one patient, and inside you'll find their meds, all prepackaged and ready for, say, their 8 a.m. dose, their 2 p.m. dose, and so on. It's like a super personalized, ultra-secure meal kit delivery service, but for medicine. Now, hospitals can run this system in one of two ways. You have the centralized model, where one giant main pharmacy does all the work for the entire hospital. Or you can have a decentralized model, where each floor or wing has its own little satellite pharmacy, which can make the whole process even faster. What really makes this system so incredibly safe is the number of checks and balances built right in. Just follow the journey. The order is checked by a pharmacist. Then the cart is filled and then double-checked by another pharmacist. The nurse checks it again before giving the dose, and when the cart comes back, it gets rechecked one more time. It's a system literally designed from the ground up to catch and prevent human error. Finally, no matter which of these systems a hospital uses, there's a special class of medications that needs its own, even more secure system within a system.
We are talking about controlled drugs. These are substances with a high potential for abuse, so their handling is governed by some very strict laws. That lock you see, it's not just a suggestion. It represents a legally required fortress of security protocols.
The chain of custody here has to be airtight. Everything is under lock and key, period. A totally separate logbook tracks every single pill that moves. The responsibility goes all the way to the top, to the medical superintendent. Only the chief pharmacist can buy and dispense them, and a specially designated trusted person has to be the one to physically deliver it. Every single step is documented. There are no exceptions.
So, as we've seen, from the simple prescription model to the super complex unit dose system, every hospital is doing this constant balancing act. And that leaves us with a final question for you to think about. When it comes to the journey of that one pill, what do you prioritize? Is it the absolute safety of a system with tons of checks, the speed of having drugs right on the floor, or the savings of a simpler model? It's a critical decision every single hospital has to make.